All right, so let's get talking about that bladder. So I'm going to share my screen of my handout. So bladder health. So what is considered normal? So the average bladder can hold about 2 cups of urine before it needs to be emptied. The average normal amount of time that you should void in between going to the restroom is usually 4 hours. And as we get older, the bladder capacity can get smaller. Everything just gets a lot more inflexible. So we may need to pass urine more frequently, but not more than every 2 hours. So if you're going to the bathroom every time you see one, every 15 minutes, then you're like Pavlov's dog of see a toilet pee, see a toilet pee, think about a toilet pee, think about a toilet pee. And we've got to space that out. So on the next bullet or the fourth bullet, it's one of my favorite things, and I always underline it. Urges are not commands to go to the toilet. They are merely a signal that can be controlled. So think about whenever you are thirsty and then you're like, oh, I don't have my water with me. I'm going to delay that feeling. Or I'm hungry. It doesn't mean that you are hungry and then you eat immediately or you'll die. It's an urge, and your body can respond to these urges, and they can be controlled. So your bladder does not have to be the boss of you. Urine should come out without any discomfort in a good steady stream, and usually straight down the middle. It's usually indicative of some muscle in weaknesses or scar tissue or something's going on. If your bladder always shoots your pee in one direction, like you always get it on one leg. And so that's usually helpful with me of knowing which muscle I kind of want to hone in on. And it should take about 8 seconds. And so I'm talking like 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. And if you are emptying your bladder and that's it, then you probably didn't need to go to the bathroom at that time. So good bladder habits. Take your time when emptying your bladder. So don't strain or push. So I know that there are a million things calling you outside that restroom. There's fingers underneath the door. There's paws scratching at the door. That phone is ringing. That baby is crying. I know. But if you push your pee out every time, then you are pushing your bladder closer to that opening. And that is not where you want to be. So I have a lot of urologists will send their surgical candidates to get physical therapy prior to a bladder lift or a rectal lift, mostly so that those surgeries are optimal and don't fail. And the reason why most of them for the past decades have been failing is because they lifted the bladder, they did a good job, and then that person sits down and every single time they pee, they push and they push and they're just straining all of their new surgical, relief. So remember that, please. So you can also mess things up though by constantly ignoring the urge to go. So waiting 4, 5, 6, 7, 8 hours between toileting is also not healthy. It'll also encourage you to have a highly concentrated urine, a highly dehydrated urine, so a dark urine if you're not able to go more than every 8, 9, 10 hours. So going to the bathroom, just in case, we call it jicking in our field, is not necessary whenever you have the first urge to go. I do live in the country, so everything is about a half hour to an hour away, and I do like people to use the restroom before they get in the car. But you don't have to use the restroom before you get in the car, and then as soon as you get into the store, and then as soon as you're leaving the store, and then as soon as you see that gas station on your way home, I want you to be in control of your bladder. So maintain good fluid intake, drink a lot of water. I mean, you hear that everywhere, but I'm going to say it all over again because not enough fluid creates a foul odor and dark color of urine, and it can also increase the likelihood of getting an infection. Unless advised by your doctor. And I have some other implications and suggestions if you're on a fluid intake recommendation from your doctor. And then the next page is how diet can affect your bladder. But then, and then the page after that is avoiding constipation. And then I have a whole thing on fiber. So this page is a good intro to the next several pages that we'll be going over. I am not going to iterate enough about cigarette smoking. I mean, we know that all the bad things that it does, but it also depletes your vitamin C. It also depletes the hydration up and down your spine in your little discs. And it can also be a cause of bladder cancer. And it can also cause increased coughing, which can also increase incontinence. So there's just like a whole plethora of things with cigarette smoking. So that is the first page of bladder health. And now I'm going to go over how diet can affect your bladder.